Assalamualaikum warahmatullahi wabarakatuh. Good evening, everyone. First of all, allow me to express my gratitude to the audience for attending tonight. It is an honor for me to be able to present this material on this occasion. Okay, before that, allow me to introduce myself. My name is Octavia Nursabila from class 3A3 KI. On this occasion, I will discuss about recognize diabetes early. Okay, my presentation will be divided into several parts. The first, I will explain the definition of diabetes, and then I will discuss the types of diabetes. And the next, I will explain fasting blood sugar levels, risk factors, common symptoms of diabetes, complications that can occur, and early prevention of diabetes. And finally, I will discuss early detection and risk management of diabetes. Okay, before I begin, does anyone know what diabetes is? Okay. What is diabetes? Diabetes is a condition in which blood sugar levels in the body are too high. This is caused by the body not being able to produce enough insulin or not being able to use insulin effectively. Insulin itself is a hormone that helps sugar enter cells to be used as energy. Okay, the next is types of diabetes. We move on to the types of diabetes. The first type is type 1 diabetes. Type 1 diabetes occurs when the immune system attacks and destroys the pancreatic cell that produces insulin. As a result, the body cannot produce insulin at all or only very little. People with type 1 diabetes need insulin injection for the rest of their lives. This condition usually occurs in children and adolescents, but it can also occur in adolescents. Eh, sorry, but it can also occur in adults. Okay, the second is type 2 diabetes. This is the most common types of diabetes. In this condition, the body still produces insulin, but cannot use it effectively, which is called insulin resistance. Type 2 diabetes is often associated with an unhealthy lifestyle, such as lack of exercise, a diet high in sugar and fat, and obesity. And the third is gestational diabetes, which is diabetes that can occur during pregnancy. This is caused by hormonal change that make the body less sensitive to insulin. Usually, this condition improves after giving birth, but mothers who have had gestational diabetes have a higher risk of developing type 2 diabetes later in life. And the last, there is also prediabetes, a condition in which blood sugar levels are higher than normal, but not high enough to be called diabetes. This is a warning stage and can still be prevented by making healthy lifestyle change. Okay, nah, the next fasting glucose level. Well, if we look at fasting blood sugar levels, the normal level is less than 100 milligram per deciliter. Level between 100 and 125 milligram per deciliter are considered prediabetes. Meanwhile, levels of 126 milligram per deciliter or higher, confirmed by two separate tests, indicate diabetes. Okay, next, the risk factor for diabetes. What are the risk factor diabetes? Diabetes is a non-communicable disease that is increasing in number worldwide. Several factors that can increase a person's risk of developing diabetes include an unhealthy lifestyle, and then being overweight or obese, being over 14 years of age, and having a family history for diabetes. The more risk factor a person has, the greater their chance of developing diabetes. Okay, next, the general symptom of diabetes. Common symptom of diabetes to watch out for include frequent thirst and urination, fatigue and drowsy, and then slow healing wounds and blurred vision. The symptoms often go unnoticed, so it is important to have your blood sugar checked regularly. Okay. Okay, next, the dangers of diabetes complication. If left uncontrolled, diabetes can cause serious complications such as heart disease, kidney failure, nerve damage, infection and leg amputation, and even blindness. And the next, prevent diabetes early on. And then the point one is eat a balanced diet. And then cut back on sugary and fatty foods. And then exercise regularly. And the last, get regular health checkups. Diabetes can start without warning and have a minor impact on quality of life. Therefore, early prevention is an important step in maintaining long-term health. With proper awareness and commitment, the risk of diabetes can be reduced before it develops further. Okay, the last, detect and manage diabetes. The early detection of diabetes. The first steps in detecting diabetes is to regularly check blood sugar levels, which can help detect diabetes early on so that treatment can be carried out more quickly and effectively. And managing diabetes wisely, with proper management, people with diabetes can still live healthy, active, and productive lives. The key is to be disciplined in maintaining a healthy diet, exercising, taking medication, and undergoing regular checkups. Okay? Nah, in conclusion, diabetes is a disease that can have serious consequences if left uncontrolled. However, with early detection, prevention, and proper management, the risk of complication can be minimized and quality of life can be maintained. Okay, alright, that concludes my presentation. Does anyone have any question, guys? Okay, if there are no questions, this conclude my presentation. I apologize for any shortcoming or errors in my presentation. Thank you for your attention. I Stephanie Sabila, I'm saying off. Assalamualaikum warahmatullahi wabarakatuh.